Hi, how are you? This is Dr. Damaris Maria Grossman, and this is the Mindfully Integrative Show. And today we have an amazing guest, and I'd love for you guys to meet him. This is a mindful chat with Philip Lombardi. He is a physical therapist and also movement specialist, but there's much more that he can talk to you about.
Man, hold on. It's Lombardo. Sorry.
Lombardo. So sorry.
Yes,
Apologize
yes.
about that.
No problem.
Lombardo. And we'll talk more further about that. So nice to see you, and thanks for coming on the show.
Yeah, absolutely, Dr. Damaris. Thank you so much. Thank you for having me here and for taking up this cause of increasing mindfulness in people. We know that that's no small challenge. Yeah.
So it's just it's just a little, I'm so glad you're on the show. I want you to talk about your story and kind of, I touched base with you with one of my great mentors, Dr. Rosen, and I know that you have so much to offer in the physical therapy space, but also to clinicians and kind of where you kind of came into where you're at now, if you'd like to talk about that.
Yeah, so my story is a complete 180 from where I am now. I mean, when I grew up, I was
usually what happens, I feel.
Well, some people ask me, oh, you did this all the time. Is this what your lifestyle was like? Your parents always tied you outdoors. And no, it actually isn't for me. So it was, I was a 3-sport varsity athlete. I ran track in college, but I couldn't even touch my toes. I could barely do a pull-up. So I would gauge that my general movement practice and my general physical capacity and fitness was actually pretty poor, despite being very, very high level and skilled in a number of different things. I mean, I could play varsity basketball, varsity baseball, varsity tennis. Like I said, I ran track, cross country. I could join a weekend volleyball league, no problem, and jump right in there with everybody. But again, the basic components and the fundamental, the macronutrients of movement weren't there. And I see this time and time again. I see this in my physical therapy practice as a doctor of physical therapy, that these kids are coming in with just higher and higher levels of skill, but the lack of movement skill and a lack of functional capability is what's leading to injuries.
And awareness of their body, right?
Oh my gosh!
I mean, that's just like the beginning, like cusp probably. But I'm just saying awareness of things. I talk about awareness, like just general. I'm like, awareness of many things.
We're going to have a great time with this conversation, because that's the biggest thing that's missing from fitness, from exercise, from everything. Think about 30 minutes on the elliptical. Again, everything I talk about, I don't want to say that anything is negative or bad or wrong. No, right. Absolutely. Going on the elliptical for 30 minutes is wonderful cardiovascular activity. Will strengthen your legs, absolutely, and get your spine moving, your pelvis moving, 100%. But again, think about like what you just said. How much awareness do you need? Most of the time, we put a TV on or a podcast or something else, and again, there's no awareness needed for that, or no mindfulness. Mm-hmm. What part of your fitness does have mindfulness?
Yeah, there's no connection at all. No mind-body connection at all. They're just like, okay, well, I'm doing it. You're like, all right, great.
Yeah.
Very true.
So anyway,
talk more.
So yeah, I became, I got my doctorate from New York University.
I'm so sorry. I would apologize. I said, Dr. Philip Lombardo.
Yeah, no, that's all right. That's all right. It was actually, I was the second class. I was very, very lucky when I went in. It was a bachelor's program, and they converted it to a doctoral program while I was there.
Awesome.
And they gave us the option of staying or going, and it was a no-brainer for me. Absolutely, I was going to stay.
Yeah, get it done. Yeah.
Yeah. 4 years after, I got my board certification in sports medicine, because it's something that was very deep and passionate to me. And then and it was a very, very successful practice, very successful time treating patients. And my mentor, who has basically brought me up in my entire career, Dr. Ben Burton, he really encouraged emotional intelligence. He encouraged self-development, which is something that I had never found in another PT job ever. And literally meeting him and working with him was life-changing, because, not just teaching something, but teaching someone to open their mind and to be more aware, whether it's treatment-based, my emotional decisions, my life decisions, they all come together and they all accumulate into all these different things. So, again, working with him for the past 18 years has been absolutely phenomenal. And then when I found the practice of natural movement, it fit in just so perfectly. And it really sparked something within me. I've done yoga practice for about 6 months. I've done CrossFit for 2 years. There's so many different areas of fitness that I really enjoyed, but nothing has captured me the way that this practice of natural movement, and the organization that promotes it is called MOVNAT, MOVNAT, which stands for moving naturally. But everyone around me who I was working out with and doing different things with noticed the change right away. And that's what sparked, again, when I was a kid, 3-sport varsity athlete. My parents, I remember, brought me camping once. I absolutely hated it. I was too cold. It rained and I got wet and uncomfortable, and never wanted to do it again.
Right.
Fast forward, last year I went backpacking 3 times. I did the Presidential Traverse in New Hampshire. Like, I'm really just connecting to my body's capability and what I'm able to do in this world and in nature. And it's both an emotional and a physical journey. And so that stems from the physical aspect, absolutely, hands down, but it stems from the process of awareness, like you said, mindfulness during my movement practice, which I never would have done, let's say, at CrossFit or just at the gym. So yeah, that's where I'm at.
Wow. So that when you transitioned into this movement natural, I mean, you got a little bit in these different parts. Was it when because I mean, you're a clinician, you're a physical therapist, you're talking about movement, you're talking about all these aspects of teaching individuals. What kind of transitioned you to, like, when you were learning about this movement, natural movement, then got you to say, you know what, I really need to talk to my patients about this and incorporate it, or for yourself?
Yeah, it was right away. And it kind of reminds me of a joke. When I passed my level 2 certification, I remember I called my family and I was telling them, and my son gets on the phone and he says, "Of course, Dad, you're a natural." And I was like, "Oh, buddy," very funny, nice joke. But that's so true. I mean, the principles of natural movement are that the skills are very instinctual, they're universal, they're evolutionary. So I was right away from the start able to implement it into my clinical practice.
Okay.
And patients love it. They felt a lot more connection and a lot more excitement about doing it than I mean, I don't know if you've ever been to physical therapy yourself, but a lot of it out there is isolated.
It's like, okay, you're like, oh, wait, your knee hurts. Let me just work on your knee. And you're like, well, it's not just the knee, everybody. There's the hip and the other side. And you're like, all right, but I'm going to just go with this for today.
This drives me insane.
I bet it must. I mean, it's just like me with my practice. It's like, all right, when someone says just take this pill, or okay, your shoulder, I'm like, no, but it's not just that. I'm sorry. But so that's when I don't know how it was for you, but it looks like, your passion then incorporated into your work. For me, it was like my own stuff I had to fix it. I was like, no, I have to incorporate something different. I just can't be the same.
Yeah, I was thinking about I was listening to your last podcast about cardiac rehab and about medications, and that same thing, it really hit me then, actually, where I thought, like, these isolated exercises that we're giving patients are like a pill or like a medication.
It's like on the same, and you're like, that's not going to fix the connection, the mind body connection, and it just doesn't. It's not a one fix.
Yes, it's not wrong. Again, I want to say
it's not wrong. No, it's not wrong. We're not here to say negative. We're here to say incorporating and integrating.
There's so much more potential out there to help people accomplish the same goal. Again, I'm not saying that, oh, they're missing something or you need to do it this way, but I'm saying if you do it this way, you'll get much more excitement out of the patients. Right. Again, that sense of accomplishment. No one's ever gotten a sense of accomplishment in my practice from doing TheraBand exercises. But when I show them, when I get them on the floor, they're on their hands and their knees, they're transitioning to an inverted crawl position, back to a foot hand position. And like, we go over that. Yeah. And at first they're looking at me like I'm crazy, and then they get it. And they get that sense of accomplishment. And as a clinician, so they're excited, their endorphins are rushing throughout their body. Right. They're telling their body, oh, this is something good for me. This is not a negative experience that's being imprinted. And I know that their infraspinatus, their teres, their lower trapezius, and their lats are all firing, activating. So it's a win-win. Again, it's not just mumbo jumbo feeling good. there's a clinical aspect.
There's right. And I talk to people about that as a clinician, you know, someone's like, oh, are you talking about the stuff that's airy fairy or esoteric? I'm like, absolutely not. I'm a lot about the science. I'm a lot about evidence-based, but then I'm also about these other aspects that need to be incorporated. And that's, I think, this passion project show. And that's why I love talking to individuals like yourself, major clinician, but also understands that there's more that needs to be connected. That's awesome. So when, I can imagine like your transition. I don't know how it was for you, but I know for me, when I transitioned into saying I wanted to change my practice and other things for individuals to more of that personalized and different way, or not necessarily fully personalized, but somewhat. When you transitioned and saw this change in your patients, did you notice your practice even got even more, not necessarily just popular, but you were like more fulfilled, like you could have less patients, or you just felt more fulfilled in your work?
Yeah, I mean, the patients want more, you know,
Yeah.
whether it's, I also teach a 1-day workshop twice a year. And so a lot of them are asking, hey, can I do that? How can I get involved? You know, how, you know, we did this for my injury, for my specific pathology, but what if I want to do this for my whole body? Because you're right. A lot of people are specialized as cyclists or runners or something else. And this is an easy addition into what they're doing. Right. So the practice, yeah, absolutely. The practice has always been successful. And I say that humbly, because of, again, a lot of just the emotional connection that we provide for people. We are, I would put our organization's credentials up against any organization.
Oh, awesome. Yeah, you can talk about it. You can say the name. What's the name of your practice?
Yeah, so we're the New Jersey Centers of Physical Therapy. We have 4 locations in Wayne, Pratt, Montville, and Riverdale. Great. And I'm very, very proud of the fact that we're the largest privately owned practice in physical therapy.
That's amazing. Yep. Hello?
Therapy, a lot of physical therapy practice, neurobiology and emotional intelligence that we use to connect with our patients and to gain their trust, to give them a sense of understanding while we're treating them. So yeah. I mean, I could go on and on. Again, I would say it's the combination of the emotional intelligence and interpersonal neurobiology combined with advanced manual therapy skills. And then for me, adding in the addition of the natural movement is it's pure gold.
That's beautiful. That's awesome. That's really, really beautiful. Would you like to share, obviously you said you had an inspiring doctor. Was there anything else that inspired you to kind of go into this path more, or when you have been kind of going into your natural movement? Because I know we'll talk further about, you know, you're doing a course for clinicians, because now, like, you've done this for yourself, you've done this for your patients. Now you we're saying that you're transitioning into helping clinicians. Was there something that kind of clicked for you to say, I have to teach this more? What kind of, or what was something that kind of stirred up for you, like, or inspired you?
Yeah, it was the patient feedback, you know, is as I was, you know, doing it myself, hands down, lit a fire, a huge fire. Again, if anybody is listening to this and feeling bored with their workouts, and again, it could be anything. I was doing, you know, trail running, 5Ks, 10Ks, 25Ks, and they were great. And I've enjoyed my time out there, but even the training was not fulfilling, you know. And, you know, road cyclists that ride hundreds of miles, they have a passion for it, but sometimes it feels like there's something missing. So if it feels like there's something missing, please reach out to me, you know, ask a question, anything you want at all, because this is giving me that whole, a sense of wholeness where I could still go out and run a 5K or a 10K. I can still, you know, do everything else lifting weights. I can still do everything else that I did, but it incorporates even more. And so my patients got that right away too. They got a sense that, okay, you know, Phil is treating me not just as my injury, not just my pathology, but he's treating me as a whole human being. And you know what? I'm enjoying this. Like I feel a sense of accomplishment. I can't wait to see what he has next. I thought he was crazy when we started, but I really,
He really does. He
enjoying
really
it.
cares. He looks and he wholehearted. I consider it like wholehearted medicine, whole health, like you're looking at the whole picture and you're seeing not just that person's injury and their disease. Like for me, it's the disease. You're the injury, right? Or whatever that. And it's like, and I mean, I don't know if it's that we're bringing back more heart into medicine or more like mind, body, something, but
Yep.
whatever it is, I know that it was something that I felt like I had to do. It obviously you felt like you needed to incorporate it more with your patients and in your life. Have you found that you've done more of this even with your family or your kids or like any, I mean, I know obviously you do it at home and stuff, but have you ever incorporated it with your kids at all? I was just talking about children and stuff.
Absolutely. The overflow definitely comes out there.
Yeah.
One of my least favorite, things to say to the kids is be careful. I hate that expression. Personally, it just brings up, some frustration and worry that we're not allowing kids to explore things. So my 8-year-old will literally grab onto the handles of the refrigerator, climb up it, get into the cabinet above it while he's holding onto the refrigerator door. Okay. Mine just his feet are on. He's climbing up. He'll get something out of the top cabinet. He'll come back down. No problem. I'm watching him. He's safe,
Mm-hmm.
or he'll jump up onto the counter to get something from a high shelf.
Mm-hmm.
And again, I'm watching him. He's safe, or he's protected too. Like I'm there as a backup, but I'm not jumping over to him. I'm not telling him how to do it. Like he knows how to do it. Giving them space.
You're giving him space to like be himself. That's cool.
Yeah.
I just, I always talk about family too. It's always incorporated with my little one. So, I appreciate what?
It's hard though. I mean, this, right? Like,
very much so.
Every time I bring them hiking, they, when I tell them that's what we're doing, okay, Saturday, we're going hiking. Oh no, Dad. Oh, you're kidding me. You always make us go. We never have any fun. And as soon as we're done, they say, that was the best hike we ever went on.
Oh,
we have pictures, we have videos of them throwing rocks, climbing on rocks, jumping off rocks. And, we could sit there all day.
Yes.
So, they really, it's a challenge as a parent. I want to acknowledge that it's a challenge to bring it into your home. Sitting at a coffee table instead of sitting at the dining room table, everyone was against that at first, but, then we're more comfortable with it. And it's just a different position to sit in.
Yeah. And I mean, you don't have to incorporate every moment, but every so often. That's cool. Would you like to share, obviously I want you to talk about what your upcoming events are and your work with clinicians, but would you like to just share any additional tip or that for the audience? And I call it a mindful way, but something that you'd like to share that.
I always like to ask people to think about their long-term goals and think about their life 20 years from now, 30 years from now, and how what they're doing now is helping or not helping that. The simple, I always think of this article and I always talk to my patients about what's called the sitting rising test, which was designed by a doctor in Brazil and was published in the European Journal of Cardiovascular Prevention back in 2012. And it showed that the more limbs that you needed to get up off the ground, the longer your life expectancy. They saw a correlation between those two. And so again, if you could get up with just using one leg, your longevity was a much, much higher rate. So what I would encourage people, again, just thinking about if you're getting stronger, if you're getting better cardiovascular strength, but you can't get up and down off the floor, well, think about what that's going to mean 20 years from now. I'll even give you your listeners a challenge and yourself as well. You could try this now or when we get off. But what I want you to do is just sit cross-legged on the floor and see if you can stand up without using your hands. The cross-sit get up is one of the simplest fundamental kind of tests that we can use. It's not such a far reach, but I'm even amazed when I have interns that are 20, 22, 25 years old in our clinic, and they can't do it.
They don't have the core.
They don't have the core. They were varsity athletes. They were college athletes. Mm-hmm. They don't have the hip mobility.
Yeah. I remember from yoga. So like I've had to do an array of different things, but yours I still think I'm lacking. So I could definitely use some of this movement there.
It's fun to explore that. It's fun to say, oh, wow. Like, again, from a place of curiosity, whether it's crawling, ground mobility, climbing, so many yoga instructors and students that always come to my workshop, they their favorite part is always hanging. When I get them up on a bar and they're like, oh, I don't know, I've never done this. And then they get on the bar, they swing back and forth, all that stuff. They're amazed, and they feel such a sense of, again, that childhood playfulness, that excitement, all those things that come together. Yeah.
That's fun. Oh man, that's cool. I like it. So let's talk. I mean, we talked earlier, you've incorporated this passion in your integrative health, you have a successful business. You've incorporated your movement, natural movement with your patients as a clinician, and you now are trying to incorporate it to your colleagues at work. And then also to other clinicians. How exactly are you doing that? And I know you said you're having an upcoming event. How exactly are you incorporating that? And what exactly got you into trying to go, hey, I need to teach other people?
Yeah. Again, I'm going to go back to, my own inspiration as I'm doing this literally every day. Okay, admittedly, not every single day, but on a very, very regular basis.
As much as you can. I mean, per reality, we can't do everything every single moment.
But the passion that comes, like when I'm doing things, I really am I mean, I can't overemphasize this enough. Like I really am enjoying the exploration and the body awareness and, things along those lines that come with it while still lifting. Again, I want to clarify, I'm lifting sandbags, I'm balancing on a rail 7 feet off the ground. Like there's a lot of advanced things that I'm doing and simple basic things with ground mobility, but they all bring me a very, very similar sense of excitement, exploration, curiosity. So I experienced that. I found that in my patients, that anytime I was doing it with them. I still remember a 19-year-old girl that had hip surgery. I started, doing some balancing work on a 2x4, carrying a kettlebell. Mm-hmm. And there was part of me, I'll be honest, that felt like, okay, this is going to be boring, or this is, she's not going to be very interested. And the one day that I didn't do it, she said, can we do that balancing thing? Like, I really like that. And I really enjoyed that. So again, that's what's inspired me to keep going. And again, MOVNAT or the organization is an international organization. They teach certifications in, I think it's 30 different countries, and Europe, South America, North America, China, and Asia. And so they're all over. And I've been talking to them for about 3 years now about having a medical course, and they're ready, and they pulled the trigger last year. And I was really, really pumped and excited that they chose me to be the director of the curriculum. And we have a board of 15.
Congratulations.
Yeah, we have 15. And again, as much as I take on that role, the 15 clinicians, doctors of physical therapy, doctors of chiropractic, and doctors of osteopathy around the world, Europe, South America, North America, are all contributing. And so it really is an intense program, and it really has a lot of diversity and from each of them in each of their own backgrounds. They're all MOVNAT certified trainers, but they're also coming from different backgrounds. So it's great to get that perspective and to put together a curriculum that's now going to be geared for the first time specifically towards clinicians. And that could be any medical professional. If you teach movement, if you educate your patients about movement, this course is for you. Primarily, we're going to have continuing education units available for athletic trainers, physical therapists, and chiropractors, but certainly nurses, MD, DOs can all benefit from this course, 100%.
Oh, that's awesome. No, I can't wait to put that into the show notes and let people know about it. And what is the main way that people can reach out to you? I know that you have your practice, but is there a way that a website that they can reach you directly? I mean, I'll have everything available for those listening and watching.
Yeah, absolutely. The website for our organization is NJCPT, which stands for New Jersey Centers of Physical Therapy.com. And MOVNAT, MOVNAT.com has all the workshops, certifications, and the medical course coming up in March. So you can reach me through either of those.
All right, that's wonderful. Is there anything additional you'd like to share with the audience before we go?
Yeah, again, I just really, really want to challenge people to question themselves and question. As a society, I feel like we've accepted a downward spiral as we age. And again, this is something I talk to my patients about all the time. We've accepted, I can't do that anymore. I can't do that anymore. I can't do that anymore. I go to the gym, I'm healthy, I'm fit, but I can't do that. I can't do that. I can't do that. I can't do that.
So interesting that you say that. Yeah. So
And
like, it's like, oh, like, for example, I think my mom was saying, oh, I can't, like, yeah, like you said, touch your toes, or I'm not able to move my leg, my knees hurt. And you're like,
yeah,
okay, yes, maybe it is arthritic, but what else can we do to incorporate so it's not always in pain,
and it doesn't have to be cure the disease in order to
You're not
accomplish.
curing, you're managing,
Exactly. And
but
you can
making
still
it even better,
accomplish.
right?
Right.
Say that again.
Right. You can always accomplish those skills. There's other ways to accomplish that skill, and to put the pieces together. Again, don't just cross that off. Don't just accept that and say, oh, I can't, lunge down to the ground. I can't kneel. I can't sit on the ground. I can't get up off the ground. So many patients say that. I'll show them something and demonstrate it, and they're like, oh, I can't do that. And literally within 6 minutes, they're doing it, fully capable. Maybe we're fine tuning a couple things still. They could be a little
Right.
more efficient. We talk about efficiency and adaptability of movements, but just the fact that they can accomplish that. So please, please, please. And Natural MOVNAT offers e-courses and themselves, and so many different opportunities. And please, 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 again, I just get so passionate about this. Do not accept lack of capability, and find, even if it's not me, find another clinician, find somebody who can take you on that journey to get back to the skills that, again, as human beings, not as athletes, we need to stop idealizing athletes, and we need to start looking at ourselves as human beings, giving ourselves credit, giving ourselves acknowledgement, and giving ourselves some hope.
I love that. Thank you so much for your words of wisdom, and for, someone here needs to listen and to kind of be part of the solution, and just also not accepting the one way, and I think it's not just thinking out of the box. It's just trying to make their life better. So thanks so much again for coming on the Mindfully Integrative Show. Thank you all those that have been listening on this mindful chat with Dr. Phil. And we look forward to having you guys on the next show. So all the information will be available for you guys in the show notes. So thanks again. And I hope you guys have a wonderful day, and make sure that you have a mindful way each and every day. Thanks again.